Hi you guys, my name's Dr. Carey Hemmelgarn. Today we're going to talk about Lyme disease.
This show is brought to you by Merck Animal Health, makers of Novavax vaccines.
I'm going to tell you a little bit about myself. So I'm a small animal critical care veterinarian. I clinically work right now on the emergency floor seeing triages and in the ICU managing our intensive care patients. I went to vet school at Washington State. I then followed that with a small animal rotating internship and a 3-year residency in emergency and critical care medicine. I'm also the co-founder and CEO of IntensiVets. It's an online training platform for veterinarians and veterinary technicians for continuing education. I have a deep passion for educating the veterinary professionals, and that's why I'm here today to teach you guys about Lyme disease. Lyme disease is caused by a spirochete bacteria of the Borrelia species. Borrelia burgdorferi is the most common spirochete to blame, but there are other Borrelia species in Europe and the Midwest states of the US besides burgdorferi that have been implicated. This spirochete is carried in by ticks, mainly the Isodes scapularis, but other Isodes ticks have also been capable of transmitting the disease. Transmission is usually noted in the times when you'd expect the ticks to be most active and people to be most active. So that's going to be in our spring, summer, and fall months when the temperature is greater than 40 degrees Fahrenheit. A tick needs to be feeding on a human or a dog for greater than 24 hours to transmit the disease, although there has been some thought process it could happen after 12 hours, but most commonly it has to be over 24 hours. The most common clinical signs of Lyme disease falls into categories of Lyme arthritis or Lyme nephritis. Less common manifestations of Lyme disease is myositis, myocarditis, perinephritis. All of those have been described in a small number of cases, and many seropositive dogs are asymptomatic and never show clinical signs. An interesting fact is that cats can be seropositive, but clinical disease has never been noted on them. Thoughts are that they do not develop signs secondary to the fact that they're better at taking ticks off themselves, but that wouldn't quite describe why they can still become seropositive, but they never actually show clinical signs from it. Tests that are available to further diagnose Lyme disease in our patients is serology that can be via all of these tests have a hard time distinguishing between acute infection and chronic infection. A quantitative C6 is not recommended as a screening test for symptomatic patients, and that a C6 testing is looking for antibodies against a C6 protein, which only occurs with natural exposure to the Borrelia species, and this protein is not present in other vaccines. Antibodies secondary to other types of proteins, such as the Q6, the VZ, or the outer protein C, all indicate exposure but do not prove that clinical signs are present from Lyme disease or predict future clinical signs. Antibodies can develop 3 to 4 weeks after the tick bite, with the most common clinical signs with Lyme arthritis being fever, joint swelling, lameness. Local lymphadenopathy would all be what we would expect. So treatment is recommended in all symptomatic patients, and that's a 4-week course of either a beta-lactam antibiotic or a tetracycline, with doxycycline being the preferred antibiotic, and the response should be rapid. 2 to 3 days after starting on antibiotics, you should see an improvement in clinical signs. With Lyme nephritis, which is a different manifestation of this disease, it's an immune complex glomerular nephritis. For patients that are non-clinical and have non-progressive renal proteinuria or hypoalbuminemia that are not azotemic but are seropositive, they should be treated with a course of antibiotics to rule out any subclinical infection. Other comorbidities that can be seen with Lyme nephritis can include hypertension and hypercoagulopathy, secondary to the loss of angiotensin II. These patients should be treated with a RAS inhibitor, antithrombotics, and antihypertensives. The use of an ACE inhibitor is warranted with dogs with Lyme nephritis. Not only does the use of an ACE inhibitor improve renal function, but it can potentially prolong survival in these patients. It also helps to reduce the glomerular transcapillary hydraulic pressure, the proteinuria, and the glomerular cell hypertrophy that's seen in these patients. Treatment with an ACE inhibitor is thought to decrease proteinuria, and it can also preserve renal function by decreasing cellular proliferation and intraglomerular hypertension. Pets that are azotemic, progressively proteinuric, and/or clinical should be treated symptomatically. That's with antiemetics. They're often very nauseous, gastroprotectants, and consider immunosuppressants. Ideally, a renal biopsy would be performed. That's not always elected based off of how sick they are. If a biopsy has been performed, then treatment would be started, or pursue treatment without a biopsy. Treatment should be started as soon as biopsies are done, or move forward without a biopsy. Symptomatic dogs will often show signs of a nephrotic syndrome. Again, that's hypoalbuminemia, proteinuria, and hyperlipidemia, and oftentimes they're third spacing with either pleural effusion or ascites. Mycophenolate is the recommended first-line treatment of an immunosuppressant for a pet that has Lyme nephritis, with a starting tapering pred dose. All dogs in endemic areas should be screened yearly for Lyme disease to try to diagnose it earlier than later. If seropositive and asymptomatic, evaluation for proteinuria is always recommended. And that it's controversial right now if seropositive asymptomatic dogs should be treated, due to the fact that we don't know if there's a perceived benefit from that. The big thing for Lyme disease is prevention. We want to be very diligent about flea and tick preventatives and environmental modifications, with rapid tick removal being one of your best steps to try to help in these cases. So after they go out hiking or being in tick endemic areas, making sure we're removing ticks very early on and before the 24-hour attachment is hugely helpful in being able to minimize this disease in our patients. So the good news is that there is a Lyme vaccine that can be used for pets that are in high-risk areas or have a very active lifestyle where the likelihood of them contracting and getting bit by ticks is very high. It's not part of a core vaccine, but it is something that's highly recommended for patients that are going to be out and about in areas where they have a high risk of encountering ticks and in Lyme endemic areas. So the big part with Lyme disease is prevention. There's two ways that we can go about prevention. So one of them is with tick preventatives. So that's going to be our flea and tick preventatives. There's topical, there's oral medications. And in that regard, it does require owners being very diligent in making sure that they're giving the medications and that they're not forgetting, and that they don't forget to in the winter and then forget to restart in the summer months. And so providing year-round coverage is most ideal to prevent missed dosages. Also making sure that there are environmental modifications we can make, which is keeping grass nice and short in our backyards. There are a few lawn companies that will spray pesticides that prevent ticks in our backyard. The other thing we can do is rapid tick removal. So if you take your pets outside, you're going hiking, or you're in an area that has a high tick burden, then making sure when they're coming inside that you're removing the ticks in a very timely manner. You're always checking to make sure they don't have any ticks on them. I saw this video that was very useful of a pet owner that was using a lint roller, and she was lint rolling her pet who had very dark skin and fur, and they weren't able to readily see ticks. And so actually lint rolling them was helping her be able to see ticks that she hadn't previously been able to see when she checked. So that's a very useful tip you can talk to your clients about. The other way that we can help prevent Lyme disease in our patients is to discuss vaccinations on pets that are in Lyme endemic areas or in areas that have a very high tick burden. It isn't necessarily something that's recommended for all patients, depending on what their risks, and if they're in an area that does not have a high tick load, then it's something that they may not necessarily have. And so it's something that's very individually based. But if it is an area that has a high tick burden or a high Lyme endemic area, then it's something that vaccination could be very useful, in addition to flea and tick preventatives, to try to minimize the occurrence of this disease in your patient population. Let's review how Lyme disease is transmitted. Lyme disease is transmitted by a Zodi species ticks, commonly called the deer tick. These ticks carry the bacterial cause of Lyme disease, Borrelia burgdorferi. After attaching to a dog, a tick takes a blood meal which stimulates the Borrelia burgdorferi in the midgut of the tick to change their outer surface protein from OpA to OpC. This outer surface protein change enables the bacterium to move from the tick's salivary glands, and from there it can be injected into the dog's bloodstream, unfortunately. Once in the bloodstream, the organism is carried to multiple locations, including one of the main places that can cause a lot of problems, the joints. Dogs may still appear asymptomatic despite the disease presence in their body and despite it moving through their bloodstream. Let's review some Lyme disease facts. According to the CDC, there's an increase in ticks and a massive increase in tick-related diseases, with the number of reported tick-borne diseases more than doubling in the last 13 years. The second Lyme disease fact is that ticks can transmit Lyme disease, have expanded their geographical range, and now are being seen in places where they weren't previously seen, which exposes a lot more dogs that we weren't normally used to seeing. The third fact, the number of counties in the US considered to be at high risk for Lyme disease has increased by 320% since 1990. The fourth Lyme disease fact is that the Companion Animal Parasite Council data shows that dogs being exposed to Lyme disease in areas nationwide outside of those traditionally considered endemic of Lyme disease. So again, more dogs are being exposed than what we previously would have been considered would have been in an exposure area. And the fifth is that 75% of unvaccinated dogs in endemic areas will unfortunately eventually test positive for Lyme disease. The sixth, the best way to protect dogs with year-round flea and tick control and vaccinating those dogs that visit and live in endemic areas. Now we're going to review Lyme disease risk for your patients. First, we're going to talk about what dogs would be considered dogs that are at risk for Lyme disease. The first group of dogs that are at risk are dogs that live in or will be traveling to states with high or moderately high Lyme disease prevalence and populations of Izodes ticks that are at risk for transmitting infection. The second group of dogs that are at risk are Labrador retrievers and golden retrievers, and these dogs are at greater risk for developing Lyme disease compared to other breeds of dogs. There's also infection factors that can make infection more prevalent. One of the infection factors is that infection rates by the vectors vary by region and season and can be up to 50% in adult ticks. After tick attachment, more than 24 hours has to elapse before the first organisms are transmitted to the host skin. That's why removing ticks very early on is very important to stop disease spread. So we want to always encourage our clients to perform tick checks anytime their dog returns from outside to minimize that attachment time, which minimizes the disease transmission time. There's also morbidity threats that we can talk about. So while arthritis is the most common clinical manifestation of Lyme disease, Lyme nephritis is also something that can develop as part of this disease and is generally fatal in these dogs that are affected. So for morbidity threats with dogs with Lyme disease, while arthritis is the most common clinical manifestation of Lyme disease, Lyme nephritis is also something that can develop and is unfortunately generally fatal in dogs. This concludes our review on Lyme disease in dogs. That's everything for Lyme disease. Again, I'm Dr. Carey Hemmelgarn. If you have any more interest or questions, please follow me at IntensiVets on social media. Please like, comment, share this video. Thank you so much for joining us today.